Confluence Health was created back in 2014. Central Washington Hospital, Wenatchee Valley Medical Center, they formed Confluence Health. We have over 300 physicians with a wide range of specialties. We service an area of over 12,000 square miles, but the service area that we care for is around 260,000 people within those 12,000 square miles. I think one of the big challenges for the future of healthcare is we're going to have to learn to get more done with less. So we're going to need to rely more on information technology because, as we have seen, the labor market is much less than it has been in the past. The digital assistants will really make a difference because it's going to help us locate the supplies quicker, make them more available to our patients.
I'm a stat CNA here at Central Washington Hospital who floats from floor to floor and gets essential things for patients once certain departments are closed. We go to codes, traumas, and do transports for vented patients. And during the night shift, there's a lot of pressure on me to get something immediately, especially if a patient is coding. Infor Digital Assistant, talk to it on your mobile app. You can look up items by description and ask for the bin number for that description, and it gives me aisle 5, shelf F, row 1. So I can walk right in there and it's always right there. One of the most critical items we have in the storerooms, Belmont tubing for rapid transfusions. And before, if you didn't know where that was at, it could be a patient's life. You're not down there in time, you don't have that item, and you're not back up to the floor, that patient's depending on you to get that item. So I can search that item on my way to the storeroom, and I can look that up and know exactly where it's at to grab that item and do my job as fast as I possibly can. This has saved me an immense amount of time because before it could take up to 15 minutes for me to find the item in the storeroom. And now on average, I know, from the time I step in the storeroom, I know what shelf it's on. It takes me 1 to 2 minutes, so it's cut down a lot of time for me.
I think information on the go is super critical. As you're taking phone calls or, different meetings throughout the day, you're gonna get questions as different issues come up, and so being able to get that information right off the bat from your phone is kind of a game changer. With AI, you can just speak to it and get some information and feedback, and it's easy enough to use that it's fairly quick. You can move on to the next thing and focus on the next task that needs to get done. I think I've gotten less phone calls and emails since having some of this new technology where they have it available to themselves. If you're going to be within warehousing or at least to the distribution side of inventory management, it's essential to have ERP system like Infor to have that information and be successful. It doesn't take a ton of training and a lot of experience, so there's not an extensive amount of time to really learn how to use it.
We have a great partnership with Infor, so implementing these new tools has been great. We knew the value that they would bring to us by changing these manual tasks into automated tasks, making things easier but also more accurate. We were surprised the most by just the forward thinking of Infor in the development of these tools, and then approaching us about them and saying, we've got something that we think would help you, and having that partnership allowed us to launch them really quickly. We're able to implement all these new tools in 90 days.
I just think the interesting thing about healthcare is things change all the time, and there's always new challenges and issues that come up, and I think it's how organizations and people respond to those challenges make a difference for the patients and the communities that we serve. We would highly recommend Infor. I would ask people to say, come look at what we've done, how we do it, and sort of show off our team and how we're using the technology to prove that quality, effectiveness, and care of our patients. Without Infor, I don't think we would be where we are today in all three of those areas.